Hello everyone, I'm Dr. Ramya Bandi. I'm pediatric neurologist working at Ankura Hospital. Today we will see about stroke is a very common term that we come across in adult neurology department. Somebody near and dear to us also might have had it. Stroke is nothing but general idea is that one side of the body doesn't work. So the movements will be lesser in that side, etc. So according to the definition, stroke can be anything which will have a neurological deficit, meaning because of the nervous system, some problem has occurred in the movement or functioning of the body that itself is called as stroke. So does stroke occur even in childhood? Yes, it occurs, very much occurs, but the incidence is not very high as in adult population. And the most common or the highest risk zone for the stroke is the neonatal period, meaning the first 1 month of life. So what will be the presenting symptoms and the causes for it? So again, the symptomatology will be based on the age when it occur and then the site of the stroke as well. So in neonatal period or in the newborn period, generally the stroke will present with seizures. They will have one hand or one leg seizures or only one hand seizures, so on and so forth. Seizures are the most common. And then dull activity. The child will not be taking feed, so on and so forth. And in little older children, they can have seizures. Along with seizures, most commonly we will see this hanging limb, no movement of hand or leg, and then deviation of the face to one side, and then squint, recent onset squint. These can occur. Some kids can also have drunkard man gait, wherein they can't walk properly. Even that is a symptom of stroke. So most of the times what happens, because the knowledge of pediatric stroke is not high and we don't expect the child to get stroke, the diagnosis also will get delayed because the parent themselves or the primary contact doctor might not think that this child is having a stroke because the symptoms are also vague sometimes. Suppose let's say some child presented with only seizure. It is very unusual for anyone to think of stroke. But stroke is a great mimicker. That's why we should always keep in mind and check for the other signs of the stroke as well. Now coming to causes. What are the causes? Causes can be divided into blood vessel related causes, meaning vessel is nothing but the tube in which the blood flows. Suppose if the tube is not healthy, it will also not allow the blood to pass easily. The smooth flow will not be there, because of which the blood does not supply to the particular organ, because of which the stroke can occur. If it is in the brain, then the stroke occurs. Then the blood itself, if there is some problem with the blood itself, generally we have a very good balancing system in the body that whenever there is some injury, our blood will clot. Otherwise, the blood shouldn't clot in the tubes. So the body has mechanisms that the blood shouldn't be clotted in the tubes and the supply should be very small. Suppose if there are any genetic defects or causes because of which the blood movement is not very smooth and frequently it gets clotted, then also the clotting mechanism can occur everywhere. So if it occurs in brain, again stroke can result because of that. And next is cardiac causes. Cardiac is nothing but heart causes. If there are some congenital heart disease, meaning the heart disease which are present at birth, or if there are any holes in the heart, then also small clots which are there, which are supposed to be filtered, might not be filtered, and then again they also reach the brain circulation and then block the small sized tubes, and then that will cause stroke. Apart from these, the other things that we have to think are about the infections. So what will this infection do? Infection is a mixture of everything. Infection can lead to heart, also will lead to that small clots that I told per se. Suppose if the infection is in the brain itself, the supplying tubes will be affected and the blood quality also will get changed, because of which stroke can occur. Next common cause will be trauma, especially the neck trauma, wherein the tubes that are supplying the blood will get dissected, means they'll get torn apart or they'll get twisted, because of which the brain will not receive the blood supply. So the blood supply is very critical to any organ. So after a certain point of time, the cells in the organ will die because there is no oxygen and glucose supply to that part. So these are the causes for stroke. And not very common, but one other cause that we have to remember is there can be some genetic problems in the vessels, as I told you, which will cause tubes to get blocked by themselves. Okay, that is called as moya disease, though it is not very common. So then suppose let's say the child had stroke, what should we do? For adults, many of us would know that they will give some injection that will dissolve the clot which is present in the blood vessel tube. But in kids, the evidence is not strong and we are not yet using them very frequently. They're all in clinical trials phase. Then the second method what we can used routine is mechanical thrombectomy, meaning small surgery like is done and then we will physically remove the clot there. That has been tried in few kids, but again on the site and then how it has happened and all that, it will depend on that. Most commonly, the treatment will be conservative. That is, suppose there is infection, treat the infection. And suppose there is cardiac problem, treat the cardiac problem. And suppose there is blood pressure fluctuation, treat that. So it is mainly symptomatic along with some blood thinners that can be given. So suppose let's say it has occurred. What is the recovery chance? The recovery of the stroke is better in case of children than in adults. But then a child has to live a little longer. The recovery of the stroke is better than in adults. So the recovery chances or the amount of recovery that we get from a stroke in a child and adult, if we compare, it is definitely better for a child. And mainly after the stroke has occurred, it will be physiotherapy that we have to do regularly. For that, suppose let's say one hand and one leg is not functioning, we have to do physiotherapy and rehabilitation for that, for it to improve. If there are any further questions, you can ask in the comment section. Thank you.